As per a survey done in 2022, there are 253 million tobacco users in our country. This positions India second globally and first in Southeast Asia region in total number of tobacco users. Today, we'll be talking about a cancer that is very closely linked to this tobacco use, oral cancer. Namaste, I'm Dr. Nitin SG, consultant medical oncologist. Oral cancer is the second most common cancer in our country and it is the most common cancer among males in our country. Oral cancer affects around 1.5 lakh patients in our country every year. And most of these cancers are associated with tobacco use. It can arise from lip, buccal wall, tongue, gums, or even from throat. Risk factors of oral cancer. The most common risk factor, as we explained earlier, is tobacco use, whether it be in the form of smoked tobacco or smokeless tobacco. Smoked tobacco, mostly in the form of cigarettes, BD, hookah, can increase the risk. And smokeless tobacco is one of the most recent in our country, especially in the form of chewing tobaccos or packed tobaccos like khaini, gutka, pan. All these can increase the risk of oral cancer. Alcohol is another important risk factor, and especially alcohol along with smoking increases the risk of oral cancer. Ill-fitting dentures, especially in elderly population who have got artificial dentures, these ill-fitting dentures can rub onto the buccal mucosa or the tongue and can cause ulcer, which could be non-healing and later get converted to cancer. Sharp tooth is another important risk factor, just like dentures, can again cause erosion and ulcers and lead to cancer. In younger population, nowadays there is a trend of increasing oral cancer among younger population, especially throat cancer, and that is being linked to a virus called human papilloma virus, which also causes cervical cancer. Radiation exposure, especially therapeutic radiation to the head and neck region for treatment of other cancers, can also increase risk of oral cancer. Symptoms of oral cancer. Most common symptom being non-healing ulcer. Any ulcer, either being the lip, buccal wall, tongue or gums, which is non-healing, especially lasting for almost 3 weeks or more than a month, and especially those having pain or bleeding on touching, has to raise alarm and have to get evaluated. Sometimes it can also present with a pain or swelling in the gums or a persistent toothache. Cancer arising from the throat can either present with throatache, difficulty in swallowing or painful swallowing. And cancer arising from the tongue can present with mere ulcer, or it can also present with difficulty in moving the tongue, leading to a slurring of speech. Many a time patient can also have persistent nose pain or persistent earache as well. Advanced stage of cancer usually present with loss of weight, loss of appetite, or if it has spread to areas outside the mouth and into other organs, they can have symptoms related to those organs. Sometimes oral cancer can present just with lump in the neck, especially lymph node enlargement in the neck. A lump that just came up like that and just stayed and without any symptoms can also be a symptom of oral cancer. Now, mostly these neck nodes would be hard and could be tender also. Diagnosis of oral cancer. Diagnosis of oral cancer is mostly done by a biopsy. If you have any of these previous symptoms, you need to get evaluated by ENT surgeon or a physician. And if there is any suspicious lesion like an ulcer or a swelling, you need to get biopsy. Most common type of oral cancer is squamous cell carcinoma. Once a diagnosis is being made, then you have to undergo staging workup with imaging in the form of CT scan, PET scan, or maybe MRI scan to look for local extension. Treatment of oral cancer. Early stages of oral cancer can be treated by just surgery. Very early stages, especially on the lip or buccal mucosa or tongue, just can be removed by surgery without any other further treatments. If it is advanced, they might have to take radiation or chemotherapy after surgery. Locally advanced cancers, especially those which are not amenable for surgery, can still be cured with a combination of chemotherapy and radiotherapy without surgery. Very advanced stages, especially stage 4 disease, where the disease has spread outside of the mouth, you need to get treated by chemotherapy. There are newer modality of therapy like immunotherapy and targeted agents, which has got very good results in treatment of head and neck cancers. So, be aware about these symptoms, avoid all these risk factors, especially tobacco and alcohol use, get evaluated frequently and maintain a very good oral hygiene and thus stay protected from risk of oral cancer. Thank you.